back, everyone. For anyone, cancer is a scary word, and for many women, the fear of breast cancer is something that's on their minds, a lot of us. But are women who are have different types of breasts, are they more prone to breast cancer? That's a question we're talking about today, and it's called, in particular, dense breast tissue that we're tackling. Laurie Schirling, a registered nurse at St. Mary's Center for Cancer, joins us to answer some really important questions. We've been talking a lot about breast cancer lately with Angelina Jolie coming out and talking about what she's been going through. But let's go ahead and tackle the first bit. What is, Laurie, breast density?
Breast density refers to the amount of fat and tissue in the breast. And younger women have more tissue. As older women become postmenopausal, it converts more to the fat tissue. And the issue is when there's more tissue, it's difficult to see through the breasts.
So why is it that breast density is important? What's the big caveat here?
Because people with breast density tend to have more breast cancer, and we're not really sure why that correlation happens, but they're at higher risk.
So let's talk a little bit, if someone is concerned they have it, what screening opportunities are available for women who have dense breasts?
Well, first, on a mammography, there are digital versus film mammography. Digital is much better at being able to see dense breasts. And what happens is on a mammography, the dense breasts show up as a cloudy appearance, just like cancer does. So that's the difficulty, because it's trying to see a snowball in a snowstorm. So that is the problem.
We had a question on Facebook. Ad writes in and she says, does it, speaking about dense tissue, have anything to do with the size of your breast, and how can I tell if I am dense or not?
Okay, well, the size does not matter. It's the percentage of breast tissue versus the fat. And so 40% of women are heterogeneously dense breast. The way you can tell is having the mammogram and asking the radiologist what your density is.
I want to squeak this one in. As we mentioned, Angelina Jolie would talk about some genetic testing that she did ahead of time to find out whether or not she was prone to have breast cancer. Is that kind of genetic testing offered here in our area?
Yes, it is. There are genetic counselors and genetic physicians. And actually, as of February, because of the Affordable Health Care Act, women that are unaffected can receive that genetic counseling, and it is covered by insurance.
Very cool. Laurie, thank you so much for being with us. A really important topic. If you'd like more information, of course, you can go to our website. That's mynews4.com. Thanks again, Laurie. All right, we're going to go over ahead and go to Jen with a quick look at our forecast and a concern for today, Jen.
Melissa, we are concerned about fire weather forecasts today. We'll be dealing with that. Also, showing you some choppy conditions up at Tahoe coming up next.
It had in there. Hey, thank you so much, Laurie. You did a great job. Kempton, I'm sorry we didn't get to your question, but I only had 30, so I had to stick it in there quick.
No problem. Got it.
Laurie, thank you very much. Great job. Thank you.
Great job,
Thank
Laurie.
you.
Yeah,
Very informative.